Today we're focusing on the topic of secondary infertility. You've already got pregnant at least once. What's happening this time? What are the causes? What are the treatments? And we have some great advanced questions from you ladies as well. Before we jump into the topic, I just want to remind you that you can find Nurse Linda and Dr. Haebe right in your Premom app. If you go to schedule consultation under more, you can find them and get started for help on your personal fertility journeys. So let's get started with Nurse Linda. Tell us about your experiences, your thoughts on secondary infertility with what you've had in your experience so far.
Sure. Can't wait to get to the questions. But first, so secondary infertility, and this is just, in my mind, it's not a diagnosis, right? PCOS, endometriosis, azoospermia, PID, these are all diagnoses. Secondary fertility is not a diagnosis. It's a statement of fact, rather. You got pregnant at one point with help, without help, what have you. And now you're having trouble getting pregnant the second time. Usually you got pregnant the first time fairly easy, and then now all of a sudden you're having issues. So that's what we'll kind of label secondary infertility. So again, it's not a diagnosis. So we don't, when we talk about, well, what's the treatment? What can I do to fit? Remember, it's not a diagnosis, it's a situation, right? So that's why it's not really correct to talk about how to treat it. Now, there may be underlying diagnoses, and we can talk about that, but in itself, it is not. It is just a situation. So why is it happening, though? That's a good question. Remember, and this is like something I always have to teach my patients, when you are suffering from some level of infertility, you're not sterile, right? And infertile does not mean sterile. Infertile means you have impaired fertility, right? It can happen. It may just take a little longer, but can still happen naturally. We may need some assistance or outside medical help or what have you, but it is impaired fertility. So again, impaired fertility means you can certainly get pregnant even on your own. And again, just like somebody who might take 18 months to get pregnant, when in the law of averages, somebody else may take 2 months to get pregnant and they didn't even know they had impaired again, let's just say we've got a slight male factor problem. Okay, so we've got some infertility issues, some impaired fertility. And with this slight, let's say, low sperm count, it just means on average at my age, it might take, they say, 6 to 9 months to get pregnant. But I got pregnant like in the second month. Of course, we didn't even know we had an issue back then, right? So we get pregnant, we have the baby, we're good. We decide we want to have a second baby now. And what the heck, we've been trying for a year now and nothing. Last time, well, that's because, again, the law of averages, you got pregnant quickly the first time, but there really is an underlying issue. And now we'll look at what that diagnosis is. So that's usually what secondary infertility is about. It's actually what happened to me. That was always my diagnosis. I didn't have primary infertility. I got pregnant with my first child without was one of those, we're not trying, we're not trying, and boom, within, I don't know, a year or something, normal, boring occurrences. And then when I wanted to plan about 2-3 years later, like often we do, we want to have that second child, I was in full-blown PCOS. I had full-blown diagnoses, and I just absolutely could not get pregnant. So again, secondary fertility, meaning I got pregnant the first time without issue, it would appear, and now I've got issue. So you've got to look at, is there really an underlying issue that we never even knew about? That's the quote treatment for secondary infertility. Sometimes there's nothing wrong. And again, it's just the old age thing. It's going to take a bit, kind of thing. But that's kind of my impression. I will tell you from personal experience that secondary infertility, for me, when I went through, it seemed almost to be as painful as what one who had primary infertility, because I knew, if you will, what I was missing. And I didn't fear if I was going to be a mother, because I was, but I was afraid now I was going to have a child who was going to be alone in life. And, I wasn't going to be able to give her a sibling. And, of course, everybody's asking me when the next one's coming. So there was a lot of pain that comes with secondary infertility. And oftentimes, we're, I'm going to say shunned, but, we are shunned a little bit more than those who have primary infertility, because, the thoughts are, you already have a child, I'm not going to throw my pity at you kind of thing. So that's something common that we often have to deal with as well. So that's kind of my overall experience and a little bit of an opinion on what secondary infertility is.
Thank you. That was a really helpful, thorough explanation of what's going on there, potentially what's going on there. Dr. Haebe, can you talk a little bit to the subject?
Yeah, definitely. Nurse Linda, I think, completely nailed it. And a lot of times, what I see with this is, again, yes, people no issues with the first, or mild issues, and then for some reason the second is just sticking. The first one took maybe up to a year, and then the second one they're like 2 to 4 years into trying. Um, One thing that I do commonly see that again, because this isn't quite a diagnosis, but one thing clinically that I do see is this stress of becoming a mother really throwing off hormones, throwing off menstrual cycles, and causing this secondary infertility cause. I talk a lot about adrenal fatigue and hypothalamic, pituitary, adrenal, ovarian axis kind of dysregulation, which is where basically when you get stressed, your prolactin levels increase, your cortisol levels increase, your sex hormones decrease, your body thinks it's running from a tiger, even though it's just trying to keep up with bills and the kids and cleaning. And that throws off your menstrual cycles, and it can look like PCOS or anovulatory amenorrhea. But a lot of times, it comes to working backwards and kind of doing a reset and making sure we're taking care of mom, focusing on like all that postnatal depletion and really replenishing those moms so that they are able to conceive again. Again, sometimes sperm issues do become a problem. It can be lifestyle changes in husbands. It can be, as Nurse Linda said before, things that weren't really noticed before but are kind of showing themselves more in this next trial of trying to conceive. Also, a lot of people, sometimes the husbands will jump on testosterone replacement therapy, think nothing of it, and that totally tanks sperm supply. So sometimes it's an easy fix like that. It's just exogenous testosterone tanking sperm fertility, just little random things. But either way, it warrants deeper investigation as to what's kind of causing this. Also, a few times I see autoimmunity pop up after a first miscarriage. ANA maybe it might have been negative before, but now it's positive, throwing things off. Also Hashimoto's. Again, I feel that this tends to be kind of triggered by stress and malnourishment, but this Hashimoto's can pick up and thyroid can be off, and that can affect fertility too. So, second, unexplained, secondary fertility, I feel like is a good opportunity to double check make sure dad or spouse, and make sure, that's all looking good, but really focus on mom, take care of her, focus on that stress. And, we even talked about this with organic conceptions, just in like taking care of like your personality and yourself, and then fertility kind of coming. This is kind of similar thing, like just taking care of this vessel that you have and making an optimal place for that pregnancy to take place.
Fantastic. Thank you. Great
Kind of a
picture.
different idea, but that's just what I tend to see.
Yeah, I think gives a good idea of the different things that could be going on there. Both mentioned age, both mentioned maybe it was there already, some other things that might come up over time. We do have some specific questions now in different areas related to infertility, starting with breastfeeding. Somebody asked if my progesterone and other hormone levels are confirmed normal levels for conception. Can breastfeeding still affect conception? I want to take that one.
Yeah, breastfeeding is just one of those tricky ones, right? And it can affect our hormones in many different ways. And unfortunately, there's no hard, fast rule to exactly what's going on with that magic number of feedings or pumps per day is keeping your fertility in check. Again, if your hormones are looking good, you're cycling, you're starting to see those LH spikes or, and BBT rises, your fertility is kind of back. Sometimes people can have one ovulatory cycle and have it go away again for another 6 months while they're breastfeeding. But I would say it's definitely something to kind of be on the lookout for, and it is unique for every single person.
Okay, thank you. Then we had some questions about when they've had surgery. And actually, I think this first one just got asked again live. And this was related to what Nurse Linda was talking about. Mm-hmm. She said her right tube was blocked, but she did get pregnant. And now she knows about it because she was having some infertility, and she's wondering can she get pregnant a second time, even with that block tube?
Well, of course, she got pregnant the first time because a tube does work and an ovary does work and her uterus does work. However, she is markedly limited on, it down to literally 50%. Because of course, theoretically, you ovulate from one side or the other, you alternate each month. So one side, when you're ovulating on the one side with the blocked tube, that's going to be a down month. So you literally have half the opportunity that you would have if both tubes were open. But again, everything is obviously functioning just fine within that. But yeah, you'll certainly sense a difference in trying to get pregnant with a blocked tube, time-wise at least.
And then we had some questions that were actually about surgery. One person said they had a polyp removed in the uterus. Can I get pregnant naturally?
Sure. Yeah, polyps are an issue when you're trying to get pregnant. They're just, they're like a little skin tag inside the uterine cavity. They do need to generally be removed. Often you don't even know you have them. You may have some unusual bleeding or spotting sometimes, but often you don't even know you have it. But anything in the uterine cavity that's not supposed to be there will act as an IUD almost sometimes and prevent potentially implantation. So having a polyp removed is certainly a good thing. So now you're without polyp. Can't tell you for sure you can get pregnant because I don't know any of the other issues going on or if there are any, but certainly having a polyp removed is a good thing.
C-sections. Can C-sections cause something to be thrown off in your body is what she's asking, and affect your future fertility?
Yeah, no.
Yeah.
I mean, just because of the mechanics of the operation per se, unless there's some terrible, scarring issue or something along these lines. But, if everything was just functional, it was a, if you will, normal C-section, that's not going to alter in itself ovulation or the ability to implant or carry a baby in general. Certainly there are extremes if you've had multiple C-sections and all those kind of things, but just the act of delivering via C-section doesn't in itself alter your fertility status.
Mm-hmm. Plus, another kind of encouraging statement on that is, the odds of kind of an egg implanting posteriorly versus anteriorly, it is more common that they implant posteriorly. A C-section is going to be an anterior and low incision. So that's another kind of, I just feel like, reassuring fact to have in mind. Again, if you've had multiple cesareans, yeah, you're slightly increasing your risk every time. And also the way your body, scars, the physician's technique, all of that. But there is a lot of other real estate. So I would not give up hope on that.
I like that, real estate.
Then we had another question, and it's actually, I don't know if this is a comment. It says barbaric surgery effects. So I'm wondering if they're just wondering about maybe a botched surgery or
Bariatrics potentially causing scarring or something.
That's probably what it is. Okay.
Mm-hmm.
Yeah, weight loss surgery.
So
weight loss surgery again in itself shouldn't do anything to our reproduction. Bariatric surgery or weight loss surgery is, has something to do with your GI. And Dr. Haebe certainly can speak a lot more to impacts of GI on your general health and all that kind of stuff. She'll certainly know a lot about that. And I think probably, Dr. Haebe, there's probably a lot to be said about that for when people have different bariatric surgeries.
Yeah, definitely. Absolutely. That being said, if somebody did have like an intestinal resection or something, potentially that could cause scarring, that could maybe cause adhesions, with fallopian tubes and ovaries. Unlikely. And also, that being said, if you, depending on what kind of bariatric surgery you're having, whether it's, up here in your stomach or it's in your intestines, which, lower abdomen, closer to your uterus and ovaries, then that's a different discussion. But you're also looking at inflammation into the intestinal cavity and everything. So that could delay things as well. And that's just comes back to, again, making sure that your body is just a healthy place in general, inflammation, everything kind of taken care of. So that pregnancy can occur.
Yeah, and there can be a lot of absorption and insufficiency issues with bariatric surgery, like Dr. Haebe says, if
Huge.
you know, you got to keep yourself in check, health wise. And that's, even though that's usually a good thing, meaning you've lost your weight, you're getting to a better healthy status. But of course, bariatric surgery does not come without its risks and side effects and that kind of thing. So maybe a step up and a challenge to make sure your absorptions are working and all of your vitamins and supplements and the whole 9 yards. Yeah.
Great. And speaking about having yourself up to optimal conditions, we did have a question about weight. I know you talked, Nurse Linda, about how, and I think Dr. Haebe actually, about how your conditions may change over time, which may kind of relate to secondary infertility. They said, I've gained weight since I last conceived. Could that be why I'm having trouble now?
Well, I can tell you just strictly from my experience or the PCOS experience, of course, gaining weight is what we do. Even it seems like when we're not eating, that's what we do anyway. So it's really easy to gain weight. My PCOS was extremely weight dependent. I mean, I can state it simply. I've had 3 children in life, all of them 10 years apart because of PCOS. And the key, and I got pregnant naturally each time. And the key for me was ovulation returned. Therefore, my fertility returned when I lost weight. For me, again, just for me, I literally had to get like below 150 pounds and cycles would return. Therefore, I was as fertile as the next gal. But if I was weighed more than that and my PCOS kicked in, and again, Dr. Haebe could probably answer why this happens. I'm not exactly sure, but I can tell you for me, it was. And I know now we're going to get more into like when in IVF and that, as women have to get more serious into treatments, again, being very overweight can be an issue. Just mechanics sometimes make it difficult. And again, I'm sure I used to tell my patients, but Dr. Haebe probably has a really great background here. But in general, if your body is fighting so hard to try to keep you healthy, it's not going to jeopardize itself by getting pregnant. Of course, a pregnancy, as beautiful as it is difficult on a body. All the major systems are taxed. So if your body's already compromised, it may not agree, if you will, to a pregnancy. And so I would say that's going to be more weight related too.
Do you want to add anything to that, Doctor?
No, Nurse Linda nailed it. Hit it right on the head. I completely agree.
Okay, great. And we did have
I'm learning well from you, Dr. Haebe.
We did have a panel on this topic on weight and fertility too, so make sure you check that out. Let's see. And then I have one more question about related to IUDs in pregnancy. This person said, I got off the Mirena in May. I had some good regular cycles, 32 to 33 days. Then I had a 44-day one now, and then waiting on my next 42 days is what it's looking at. Is this normal? Thoughts on dealing with this?
I see that a lot after the Mirena, only, and this is kind of what I say, like it just kind of shut down communication for so long, and it's just kind of taking time for your body to kind of start that conversation again. So I would, just because you're having a period doesn't necessarily mean it's a real period. It's, and especially the Mirena ends up kind of stopping periods altogether. So I do find it takes people about 6, 8, 12 months after coming off the Mirena for things to regulate. Not that it can't happen. I've also had people that get pregnant, of course, the first month getting off it. But I would say, focusing on your health, making sure your nutrient status is optimized, your stress is reduced, and then allow those cycles to return again. But I do see that often.
Thank you. And I don't think we have any other live questions. So I know we talked about how secondary infertility is not a disorder. It's another version of another label for infertility, and it could be something that was already there and you weren't aware of it before, or it could be related to some of your lifestyle changes. Are there any final thoughts or suggestions you have for those struggling with secondary infertility?
Again, I would say don't get lost in the fact that it was easy the first time. Again, I would have missed out completely on my diagnosis if I just fell into, we don't want to get a diagnosis. I don't want to think something's wrong. I want to believe I can always be that gal who just gets pregnant when she wants. But that wasn't the case. So I had a reality check that this might be an issue, and again, we're kind of lulled into a false sense of security when we got pregnant the first time, and we thought, oh, good, I'm not one of them. Well, you know what? There's a lot of us out there, a lot of us, 1 out of 6 or 7 of us, couples have infertility issues. So it's not uncommon at all. So my experience has been, I want to say I probably saw almost as many secondary infertility issues as I did primary infertility issues. So again, it's because infertility simply means impaired fertility. It doesn't mean you're sterile. So of course you can get pregnant, and many of us can get pregnant on our own and don't need intervention. We just don't have 20 years to wait around sometimes for that kind of luck to happen. So just, realize that this could be real, and, get past the mourning that it's you, that you're having issues now, and, take it seriously when enough time has passed. And sometimes, like I said, nothing's wrong. Just like with a lot of the young patients on Premom, there's anything wrong with them. They don't have a diagnosis. It just hasn't happened yet. So there's a lot of times when, again, if are we truly infertile? Do we really have an infertility diagnosis? Or again, for example, a 42-year-old trying to get pregnant on her own is going to take a while. There's nothing wrong with her. She's not infertile. This is what we expect to happen, So sometimes it doesn't mean anything, and sometimes there is a diagnosis behind it. I know that's a really wishy-washy answer, but that's the truth.
Yeah, makes sense to me. Dr. Haebe, you want to add anything?
Yeah, and I feel like this is my advice on a lot of things, but advocate for yourself. Again, I like what Nurse Linda said, don't wallow in it. You look for solutions and figure out what it is that's going to make you feel better. If it's, sitting around and waiting, great. But if it's, jumping on Premom, scheduling a virtual consultation with somebody, talking through what's going on, seeing if there's action steps that you can take to at least, optimize your overall health. Getting a second or third opinion are always good ideas. So I say, really listen to yourself, tune in. What are you saying? What are you stressing about? And take action. Action tends to kind of make you feel better and also moves the needle in a positive direction.
Okay, great. Thank you very much. And thank you, both of you, for participating in this panel today. We always love having you on.
Thank you very much, Terry.
You're welcome. For those of you watching, remember you can find both Dr. Haebe and Nurse Linda right in your app if you want to go deeper under scheduled consultation. And I believe this topic came from you, those of you watching. So please let us know what was helpful from what we shared with you so far and what you'd like to see next. Have a great rest of your day.
Thanks everyone for
Have
being
a good
here.
weekend.
Bye.
Bye-bye.